Hi, everyone. Thanks for joining us today. My name is Kristen Little, and I'm the Senior Manager of Public Affairs at IEEE-SA. And while people are still entering, I'll tell you a little bit about IEEE. It's the world's largest professional association of technical professionals with about 400,000 members in over 160 countries. We have 46 technical societies and councils. We hold 1,900 conferences annually, and we offer education, and we publish a good portion of the world's electrical engineering, computer science, and electronics literature. Also, the standards arm of IEEE, where we're coming from now, is part of IEEE that brings together people from all over the world to create global, bottom-up, market-driven standards. And in sync with IEEE's mission of advancing technology for humanity, members engage in a wide variety of humanitarian activities around the world, which brings me to this session. It's a side session in the UN High-Level Political Forum on Sustainable Development. The HLPF is the main United Nations platform on sustainable development, and it has a central role in the follow-up to the Sustainable Development Goals at the global level. This started on Tuesday and runs through Thursday, the 15th of July, and the theme is Sustainable and Resilient Recovery from the COVID-19 Pandemic. So our discussion topic today is vaccine passports and databases, privacy versus public health. Basically, should travelers need to show proof of vaccination against COVID-19 or any other communicable disease? Should your vaccination data be available for research or other purposes? And people can have many reactions. They could say, can my vaccination or health status ultimately be seen by employers? Could it be seen by insurance companies? Could I be affected by that? And on the other hand, what if I get COVID and without data to work with, there haven't been advances in helping patients because of that lack of data? So in today's session, we're going to discuss how to go about both protecting the public and at the same time enabling research. We'll talk a bit about the development of global standards frameworks and the responsible adoption of technologies such as distributed ledger technologies, zero knowledge proofs, and open source metadata portability, and also the use of IEEE's Open Mobile Health Standard. So hopefully we can all put our heads together today to better understand the situation and the limitations, the potential problems, and how to avoid them. We also really want to know what safeguards need to be there for you to feel comfortable. And in this session, we'll be asking questions along the way in the form of anonymous polls. We're also asking you to ask questions of us and share your views. And with respect to that, if you could put your questions in the Q&A function of the Zoom, that would be great. And if you could use the chat for other discussions, that would also be good. So now I'll pass the baton on to the moderator of our session, Maria Pallambini. She's the Director of Emerging Communities and Opportunities Development, the Global Business Strategy and Intelligence. And she's also IEEE-SA's Healthcare and Life Sciences Practices Lead. And to give you an overview of the issues, and she'll also introduce our panelists. Thanks. Maria?
Great. Thank you so much, Kristen, and welcome everybody. I'm very excited you have joined us today. So as Kristen mentioned, I lead the healthcare and life sciences practice here at the IEEE Standards Association. And naturally, COVID in general, every aspect of COVID has been very top of mind for our technologists, our engineers, and naturally all the other stakeholders who are impacted, unfortunately, by this global pandemic. But I think more importantly, when we look at this opportunity and what we're going to talk about today, you know, we focused on it from a point of view of the COVID-19 pandemic, right? Because there's all this proliferation of digital vaccine passports and national databases of who's doing the vaccine and who's not. And naturally, we all wondering, is this the right way to go? But as you might know, and we all might know, when we travel to certain countries around the world, there was already a requirement for us to have certain types of vaccines in order to protect ourselves. As we know, there was the yellow fever, and if you go to Africa, we have the malaria. If you decide to go on safari, there's like all these different types of things, but none of us really put much thought into it. But lo and behold, when it comes to COVID-19, all of us, each of us have been impacted. And so naturally, we're talking about pretty much vaccine tracking at a very mega magnitude level. And it's important to note that this is a communicable disease, yes, but at the same time, it potentially, this whole approach to digital vaccine passports around these types of diseases potentially could set a precedent. We know there'll be future diseases in this category. We know that we're looking at the future of HIV vaccines. Is there going to be requirements like that? Not that I'm saying there is, but these are some of the questions that eventually percolate up over time. So I think it's really important here, and our conversation really revolves around, what kind of precedent are we setting? We want to set the right one, of course, for future, but as well as, is this really a technology issue? Is this a policy issue? Is this a general industry issue? Or is it a combination of all these things coming together to find, perhaps, I would say, the most pragmatic approach to addressing things of these nature? And so with that, this is the course of our session today. We, as Kristen mentioned, we want you to definitely engage. We're going to put out some polling questions for you, just to gauge sort of what our audience and what their perceptions are from that point of view. But more importantly, we want you to be able to ask questions. So through chat, we can monitor if there's any questions going through there. But as Kristen mentioned, we prefer for you to put your questions through the question area. And then ideally, we would like to have some of these questions actually vocalized. And through our technical help, we might be able to have some of our participants actually ask the question. We want to make this as interactive as possible. We don't want to just read what you have to say. I think maybe some clarification in how you address your question will also help our panelists be able to effectively address and hope to find the answer that you're looking for. So with that, I want to thank you again for joining us. And of course, I want to introduce each of our panelists. So I'm going to start first with Dr. Deepak Lara from Europe. He's very fascinating individual. I've actually had the pleasure of having him join some other panelist opportunities and some of the work we're doing in cybersecurity for connected health. But I think it's really important that we talk about, from this point of view, he's at the European Institute for Innovation through Health Data, and he brings a very, very diverse perspective. And he also works in many different areas, and he also hosts many forums. So he's very interactive, very good to chat with. And I think you're going to find him very, very, I would like to call him provocative, because he doesn't always follow the status quo when he's sharing ideas. He makes you really think and really pushes the boundaries. And this is exactly what we want for this type of forum. So Dr. Kaura, thank you for joining us. Welcome to the program.
Well, thank you for that, but also thank you for setting such a high bar that I have to live up to.
Of course,
challenging.
I'm not worried at all.
That's great. Thank you very much.
Thank you.
So I believe that we are starting off my interaction with a couple of questions for the audience. Is that right?
Yes, that is correct.
Good. So can I just say to all of you, it's more fun for me if you answer rather than just look at the screen and think, why should I care? So please fill in your answers quickly, efficiently, because it'll be nice for me to get a feeling for you out there in terms of a couple of questions.
And of course, everyone, Deepak will be sharing, we're going to share the live results once the poll is done as well.
Yeah, okay. Oh, done already.
Mm-hmm.
Wow, that's very powerful. So just in case you're not looking, do you think people should have control over what happens to their own vaccination data? 93% said yes, and 7% said no. One person said no, and nobody was indifferent. And when it comes to transparency, 100% said yes. So that's very fascinating, isn't it? Let's just think about those two topics one after the other. So control sounds ideal. It's a nice and understandable aspiration, but we would all like to have control over what happens to our data. If we think about vaccination information generally, we need it for three purposes. It's needed for continuity of care. If you've had some jabs and you see a health professional who might or might not need to give you a top-up jab, a booster shot or something, or know if you might be at risk of a disease, it's a clinical data point like any other clinical data point that you have. The second thing it does is it provides proof for people who need proof because of decision-making that allows you to have rights and privileges or doesn't allow you to have rights and privileges. And the third thing it does is it supports learning and science. Your data, if it is used in the right way, enables us to discover whether there are risks and issues and problems, prevalences, and so on. So we need to look at those three side by side. But the one that is headline for this panel is the control topic to do with the use of vaccination data to determine whether you can travel or not. So let's look at that one first. The proxy that's been mentioned and was mentioned on the website when you signed up for this panel is the yellow fever certificate. There are countries around the world that require evidence that you've been inoculated against yellow fever before you're allowed in the country. So to some extent, the COVID-19 vaccination certificate is not setting a precedent, a universal precedent. It's mirroring a behavior we're very familiar with. The difference between the yellow fever certificate and the COVID-19 certificate historically is that the yellow fever certificate was a little booklet or a document that you carried. Somebody looked at it at the point of passport control or immigration, saw that you had it, and then let you go through. They didn't keep a record, usually, of who had entered with it. In the case of a digital certificate, it will probably be scanned at an immigration point, and a snapshot of that data, the two-dimensional barcode, will be retained. And the question is, what happens to that information? Where does it go from there? And is it used for purposes that are beyond allowing you in the front door of the country? That's the part that people are uneasy about, and it's understandable they are. But let's think about the second item that you will have with you when you travel, which is a passport. You have a passport that might be a physical document, or in some countries already, it might be some sort of electronic document. Even if it's paper, it's scanned on arrival. And so it enters an electronic era. How many of you know who has access to your passport data after you've passed through immigration control? Very few of us know that information today. Very few of us have used that as a reason for not traveling. In other words, it's not that the COVID-19 certificate is introducing a brand new scenario of unknown information propagation. We've actually lived with that already with our passports for a while. The question and the challenge and the issue that I hope as an audience you'll react to is, does the proxy of relating COVID status to your passport data make it feel more comfortable than equating it to a yellow fever certificate information, which is seen but not retained at immigration? If it is retained and it is used in the country of your entry, as well as in the country of your departure, what are the fears and anxieties you've got about how it might be used in ways that you don't want? I would expect that it can be used in ways you wouldn't object to, which is to monitor the completeness of checking, and also potentially to look at the extent to which people from different countries have certificates, knowing the prevalence of the vaccines they might have had. And the certificate does tell you that. If there are then outbreaks and issues, it starts to become a useful tool to look at vaccine effectiveness, vaccine safety even. How do you feel about that? Do you feel comfortable that your data should be used in those ways? Or are you really against your data being used in those ways? I'd love to know from the chat point of view what you think. And I'm going to see if I can actually look at the questions. I'm not sure if I can. At the moment, I don't see any. But I would love to know what it is that you're anxious about when you felt so strongly, almost all of you, that you wanted to have control? Would anybody care to volunteer what it is that made you say yes to that first question?
So Deepak, in the meantime, while maybe others are getting ready to chat to you, there was a question in the Q&A box regarding were there other vaccines ever required for travel, or were they just simply highly recommended? It's not clear as to ever had to show evidence of vaccination for other vaccines.
Well, I think, Maria, you did, or your colleagues did put in the original web page, the yellow fever analogy.
Yep.
So there are countries where you were not allowed in the front, and you mentioned it as you opened the meeting. There were countries that would not allow you in without a yellow fever certificate, a valid one. And that means they looked at the date as well as whether you had a piece of paper in your hand.
Correct.
So there is a precedent of that.
Absolutely. And sometimes it's also not just the country you're entering to, the country you're leaving might also require you have those vaccines so you can come back as well. So
sure, absolutely. That's a good
it can
point.
work two ways sometimes.
That's a good point.
Yes.
While people are thinking about that one, and I'm a bit cross with you all as an audience, I'm expecting you to be a little bit more energetic than that. Look, it's my evening, but I think for some of you it's early afternoon. You should be more awake than me, not less awake than me. Transparency. You all want transparency. The question becomes, how do you get it? So there are two scenarios for transparency. One is personal and one is general. In general transparency, organizations are required to explain how data are used that they have access to, if they share it with anyone else, why they share it, and what those other parties are supposed to do with it. It's a generic answer that applies to all of the data they hold. And the other scenario, which is a much more technically dependent one, is where you can find out what has happened to your specific data. And here there are innovations. Distributed ledger is one example, and this is where we enter the IEEE space with both feet, where it is possible to give you that level of transparency. And I know that the other panelists in this group have much more knowledge about this than me. But what I will say is a challenge is the urgency. People are wanting to travel now. People are starting to acquire evidence that they are vaccinated now. And the distributed ledger technology is not embedded within immigration systems right now. So we've got a question of whether you say we wait until it's ready, because I don't want my data to be available to others without transparency built in, or whether we say, okay, it's down the road, it's an opportunity for the future. This is a great use case to lever for that deployment, but on a temporary basis, perhaps for the year 2021, we accept it won't be deployed, it won't be available. I'm willing to accept generic transparency, but I would like the organizations involved to do what they don't do with passport data, which is tell us what they're doing with the data and who they share it with, and what those downstream agencies are permitted and not permitted to do with the data. I don't know that for my passport data. Maybe some of you do, if you're lucky. I don't think many of us know what happens to our passport data when it's scanned at the immigration desk. Are we willing to accept generic transparency as a temporary measure? So audience, come on. You've got two conundra to think about. What are the risks and harms about your COVID vaccination data? Why do you want control? Why do 99% of you want control? And then, are you happy to accept generic organizational transparency as a temporary measure before you get personalized transparency? Well, I'm a bit cross with my audience, Maria. Maybe you're not cross. Maybe you're a calmer, polite soul. I'm cross with them. I wonder if we might ask temporarily if our two other panelists want to react to this. What do you think?
I just like to say with regards to transparency, and I think this
You're
is
of course able to respond as well, Maria. You're free agent to also jump in with your opinion.
Well, I would just like to say, I always think the topic of transparency is sometimes a lightning rod. I remember in the beginning when we started the whole conversation with blockchain, especially in the healthcare sector, and I know that JP and Alex can definitely jump in on this. Whenever we talk to organizations or entities about this concept of transparency, especially in the pharmaceutical supply chain, we used to see a lot of paleness in their faces. I think the concept of transparency is like, what exactly are we opening up to, right? And I think, yes, it is a feature and a benefit, especially if you use a blockchain distributed ledger technology. But naturally, there is always, again, pragmatism around what exactly we mean by transparency. So perhaps either JP or Alex can really talk about, because I'm sure they've gotten this question and probably a lot, what exactly is what we mean by transparency, how it's used, and naturally, what does it mean in this context can probably maybe give the audience a little bit of guidance and sort of passing their questions back to you. So I'll start with Alex first, because I know he definitely hit this one on the pharmaceutical distribution chain side of things.
Yeah, I mean, in pharma supply, the biggest incentive for really any of these stakeholders is risk mitigation and liability limitation. There's a certain degree of plausible deniability that stakeholders need to be able to have, and that's why we have seen this trend towards centralized data silos, towards a certain lack of transparency. There are obviously a lot of security considerations. Anytime you're transparent in one area, it can leave you vulnerable in other areas. Even things such as packaging or serialization schemes, as we've seen quite a bit. So the way that you achieve transparency is really by trying to define what has to remain behind the wall in order to keep stakeholders feeling that they have a certain degree of control over the data that they need to shepherd and hold. Transparency really boils down more to alignment around standards and alignment around workflows and process, as opposed to, in most cases, the actual content that's being moved around. If there's transparency about how things are being managed, but the things themselves that are being managed are kept permissioned access, then it becomes somewhat easier to get over the line. And that's what distributed ledger is fairly good at, because you can have sort of keyed in encrypted access to different aspects of what is a common shared source of truth.
Excellent. So JP, I know that you obviously did some work under Common Health. I know we've talked about this a little bit in the clinical trial space as well. What about you? What's been your experience with this concept of transparency in speaking either to entities or patients or both?
Yeah, there are a few interesting aspects of it. First, from sort of the clinical perspective, one of the attributes of transparency and patients' desire for transparency, and often, clinicians' sort of hesitation about providing full transparency is really well exemplified in the current conversation that's been going on about open notes. And so, folks may or may not know that as a patient, you have right to access all of your clinical information, which includes your notes. But from a digital perspective, those notes have not been made available to us yet under the regulations that the US has provided for making those data available. And there's been a lot of pushback on this from both sides, right? From the clinical perspective, the doctor's interpretation is that this is a private space where I'm taking notes that are really only relevant for the care team to know about the patient, and these should not be available to the patient. From the perspective of the patient, if this information is in my chart, I should have full access to it. And we're sort of coming toward a space where perhaps notes might become something that's a little bit more collaborative. And this is certainly going to change some behavior on the part of what gets written into notes. But generally, we hope that that will be a good thing and a positive thing. And I think that this one small example is sort of a good indicator or a good example of the types of ways that transparency can be perceived both positively and negatively from both sides of an equation. The second anecdote that I'll share, which is a much more recent and timely one related to COVID vaccines. In New York State, we have the Excelsior Pass. So IBM in the state of New York collaborated to provide people with a blockchain-based system for getting access to your COVID-19 vaccination record provided by the state registry. It goes into a digital wallet that lives on your phone, and you can use that to get access to Madison Square Garden, for example. What no one expected in my conversations with folks at Public Health, at the Department of Finance who runs it, at IBM, is that there was immediate and swift public backlash that no one had any idea that the state had all of this information stored about them. And you go to this website and you input your name, your birth date, the date of your recent vaccines, and it generates this pass. And a large portion of the public was simply shocked that the state of New York already possessed this information about them. And that's just a sort of anecdote for the times and an example of where it's not necessarily that there was a lack of transparency. It's not secret information that states keep registries about our vaccination information, but it's not especially well published. And how well that's documented in public knowledge can also go a long way in determining what is transparent and what's not.
And whether it's
That's
actionable.
Right.
Yeah, that's really interesting.
If I was to link your examples to a question I can see, which is how people feel about this comparison or these comparisons with what people give away freely on social media, I think we do have a rather heterogeneous, maybe even if I dare say confused attitude to privacy protection as a collective. Whether individuals are confused or not, that's not for me to say. But collectively, our behavior is wacky at minimum. Because people do give away huge amounts of information all the time. We also know, apart from social media, that a number of retail outlets like supermarkets collect huge amount of profiling information in exchange for loyalty type benefits, points, discounts, whatever they do that because they know who you are and they monitor what you buy and they use that for all sorts of strategic purposes. I don't mean negative ones, but they do use the data. And the public are blissfully unaware of most of that. But we do get very uptight when agencies we didn't realize have information about us. And that is the paradox of the human condition. I think though, JP, I'd like to ask you this question. The requirement for greater transparency, so not necessarily personalized, it can be, and both you and Alex are very strongly able to deal with that issue of personalized transparency, but even organizational level transparency, saying this is the information the state holds about you in general. We may not have every data item on each person, but this is like the superset of things that we generally collect. And if you ever provided us with this information, we will have retained it. That kind of transparency and the transparency you described in the medical world are examples, I think, of where we need society to go. There is a lot of debate going on in Europe right now in relation to health data reuse. So, for example, when a pharma company has access to anonymized data sets, they should declare what they're doing with that data to the level that it doesn't infringe their commercial details. So it might not be very precise information, but it's coarse-grained enough that the public know what they're doing with data sets in general. And I've encountered pharma and medtech being actually quite open-minded about that level of transparency. I think that there is, in the medical profession still, some hesitancy about openness with patients. But I do think in Europe, we're ahead of you in the US. I mean, in the UK, for example, when I was a general practitioner, patients had access to their records in 1990. That was the legislative year. But I found as a GP for several years after that, not many people really wanted much information. But I've also seen examples, for example, in Sweden, where a large volume of people's health records were made available online. And prior to this, the medical professions were very, very anxious about two scenarios. One was that patients would get worried. They would see things that perhaps they hadn't understood, and there would be a huge amount of concern among the patients about things they read they didn't understand, and the second concern was their workload would go through the roof because they would have a huge number of people calling them with anxieties and issues and wanting to discuss and debate things. Neither happened. Hardly anybody found something in their records that scared them to bits. And the workload, because it was monitored, there were evaluations, did not go up at all. So I think we have a lot of fear of transparency, a lot of anxiety.
The
How do
elephant
we
in the
help
room
people?
the elephant in the room when you're talking about the European versus the American context is that the conversation about how the US government manages information about its citizens, what they're taking in, where they're funneling it, how they're using it, almost inevitably sort of leads back to the military, NSA. The incentive structures are a little bit different in Europe, which is more multilateral and not,
yeah, well, I don't
not a military
understand.
superpower.
I don't understand that US paradigm as well as you do. So maybe could you just say a bit more about it? I mean, are the US citizens right in being more fearful?
I don't think that the US citizens are necessarily more fearful. I think it's that the state actors themselves have somewhat different incentives in terms of when and where and how to expose how data is being used, where it's being taken in, and where it's being funneled. And certainly post 9/11, most of those conversations, when you start to go more than a few steps in, essentially say, we're not going to tell you for reasons of national security. The US government is very much involved in gathering up a lot of information about its own citizens, and it's very much involved in gathering up information about everybody else.
And is there any demand from public or consumer organizations to say that the phrase national security is a vanilla carte blanche to say, you have nothing and I'll never give you anything for any reason at all? Is there any accountability for that phrase?
It's taking place at the state level right now. I mean, California, New York, that is where a lot of this work is actually being done in terms of carving out greater privacy protections and requiring certain disclosures. Even then, it tends to focus more on corporations, but we are starting to see some of that pushback. I would also say, for anybody who remembers the PRISM program, the fallout from that was considerably less than I think many of us expected it might have been at that time. And to take another more contemporary example, the SolarWinds breach, it's fairly clear right now that we still have malicious actors who are active within US state and federal computer systems. They will be for some time. There's not a clear way to root them out. The US government overall has tended to be more concerned with the amount of information they have on their own citizenry, even to the extent that they would be, considerably less willing to pursue decentralized solutions that would, block non-government actors or, extraterritorial government actors from being able to gain access to the same data. It's a fundamentally different approach. It's different. It involves different incentives, and the real decision makers or the source of the inertia within the US context is, that mid to high level, the folks within the national security complex and, HHS as well. They want visibility, and to the extent that they want that visibility to be able to, achieve what it is that they want to be able to achieve, whether that's, pharmaceutical drug supply integrity, whether it's a number of different national security objectives, that is the overriding concern. And again, you can't really do that in the European context because it is so multilateral and because there are so many other actors that you have to work with. I think Europe has undergone a very, very different trajectory over the last 60 years compared to the United States.
That's very fair. And I think that's why transatlantic discussions are so interesting, because we start from seeing the world in a different place. We bring different prejudices and fears into a discussion, but I think we can also learn a lot from each other.
Yeah, there would be no California Privacy Act if it weren't for GDPR.
Right, right.
That is correct.
That's a great example. Very good.
So,
Maria, do we have any more inputs from this sleepy audience who's had a heavy lunch and is now relaxing without coffee?
could be. I think we have, so we have some points coming out in the chat. I think one of the interesting ones, and we'll get to this, and then I would definitely like to bring in Alex and JP to talk more from a technical perspective, which may sort of give a little more insight to this concept of transparency if we get to the technical fundamentals of what exactly that might look like without going into too much coding, let's just say. But I do believe that there was one interesting question with regard to transparency, and I think it's beyond about technology. It's more about how long is this data going to be held, right? Like, let's say, like you mentioned, the passport example. I don't really even know what we enter. We know we got to renew our passports in the US every 10 years. We know that's a rule, that's a requirement. But from a point of view of every time you enter a port of entry to any country, like how long do they hold our data? You know, is it forever? Is it for 10 years? Is it for, so, and then the question becomes, well, with this vaccine data, how long are we talking? Is it basically a year? Because if you say the vaccine durability is a year old, like it holds a year, right? Your boosters for a year. Is that how long they hold the data? Or is it, you know, for 5 years? I mean, so who would kind of set that protocol and from that point of view?
Well, I do think that should be part of transparency. So certainly, I mean, Alex referred to the GDPR, and for those in the audience who may not be familiar, it's called the European General Data Protection Regulation. And it's now coming up to 3 years old. It is 3 years old. And it is an overarching pan-European regulation. That means it's a legally enforceable instrument, although each country is required to slightly nationalize it to make it fit in its country. And it specifies a number of principles, which includes that data should only be the minimum data that is held that is necessary to fulfill the purpose for which you were permitted to collect data, and only retained for as long as is necessary, although it does have provision for the fact that you might wish to anonymize it in some form to keep a longer term scientific purpose going. However, it's a soft, I mean, it's a firm regulation, but it doesn't specify a number. And it doesn't require that the number is predetermined. It simply says the organization has to hold it for as long as necessary and then no longer hold it. But I would like to turn that from a sort of consent permissions thing into a transparency thing, where I think it would be appropriate for organizations to indicate what they expect to be the duration of holding information. And we need to remember that in the case of things like the fundamental question, the COVID-19 passport, the border control agencies probably don't need to keep that data for very long. However, there would be value in having an anonymized archive of that information for scientific purposes, which the public might find acceptable if it was anonymized and held by bodies that they trusted, and with very tight constraints on what's permitted to do with it, such as looking at infection spread and outbreaks and so on, public health scientific purposes. But I think we're entering absolutely the space of the other two panelists, and I think I should stop and let you move the debate on to their inputs.
Perfect.
Yeah, JP, I'd like to hear what you think about this, but it is very difficult for me to envision certainly a U.S. Government stakeholder saying, you know, we will hold this data for so long and then no longer. The tendency would overwhelmingly be, you know, throw it into a data lake, and then if we decide that we want it later, storage is cheap, deletion is forever.
Yeah, I think we're probably on pretty much the same page there. I think that's absolutely been the tendency. I think in communities outside of U.S. government, the research communities, things along those lines, there have been a lot of work over the last 8 to 10 years mostly, but before that, but mostly over the last number of years with electronic consent and sort of how we go about storing data for, longer term use in different use cases, things along those lines. But yeah, from a government perspective, I think that has certainly largely been the approach here.
Interesting. Okay, so we had one interesting question by Sarah. Thank you on the chat, and I think JP and Alex are going to be able to address this in their technical conversation, which is the question of cyber breach. Obviously, when it comes to privacy, that is like top of mind for us. But I also think this brings up an important point, and I think Alex started to scratch the surface of it. Is the reality is there's a little bit about this idea of the harmonization, right, of this vaccine passport. What I mean is, if Europe's going to have its rules, US is going to have its rules, China will have its rules, what is this thing going to look like? And so with that, I think it's a great lead in to officially and properly introduce Dr. JP Pollock, who is the Chief Architect at the Commons Project Foundation. So JP works on a lot of cool stuff. One of them is Common Health. And for those of you in the US, and I'm sure globally, you might have heard Apple Health. So we have Common Health from the Commons Project, which really talks about how we can collect health data from real world settings and their clinical record of patients for research and potentially getting involved in clinical trials and things of that nature. But the next step in the Commons Project, which is one of the exciting things and started my introduction to JP, was the Commons Pass. And maybe some of you might have heard this in the US news, Commons Pass at the airports. I know Newark Airport in New Jersey was testing this concept. I know other airports were also testing it. And JP is sort of, let's talk about JP. He knows the insights and the workings of how that pass will work. So with that, JP, I'd like for you to give us a little insight. I think we've had some conversation about some standards around the work best practices that we're seeing from Common, like the outcomes from Commons Pass. And obviously you mentioned a really important project in New York, the Excelsior Pass. We know that that's a state-driven project. That's not a national project, but we're seeing these little things pop up, not following any kind of real standard. They might be using blockchain, they might be using something else. How are they getting this data? How are they showing it? I mean, there's a lot of core questions, and perhaps maybe you can share some insight on the work you guys are doing there. I think we have some questions for the audience though, right? Before we go to, here we go, for them. So let's see. So audience, please take a look at the pop-up poll that we currently have in progress. We have 2 questions for you, and then we'll share the results live as well. Let's see. We have, how easy do you think it is to game the system? Oh, that's a good question. And our second question, we have 3. Should we give away our personal information for the benefit of social good? So sort of contributing to research. And finally, are you comfortable letting an automated system decide to let you into a country? So definitely autonomous systems top of mind here. We have a few seconds left. Okay. So we got some results. So JP, maybe you can take a look at these results and see if this sort of resonates with what you're seeing and things that are going on currently in the space.
Yeah, absolutely. This is really interesting. So the first question, how easy is it, do you think, to game the system? So, maybe in a minute, I'll talk a little bit about the system that Maria gave a little bit of a prelude to, and then we can see how you feel about this after hearing a little bit more about the system. But answers are quite mixed, which I tend to think is pretty appropriate way to respond to this question. The second is, should we give away our personal information for the benefit of social good? And we had an overwhelming yes here, which makes us feel good. And we'll talk about that a bit more in a minute as well. And then the third, are you comfortable letting an automated system decide to let you into a country? And we have very few yeses, a number of no's and some indifference, which I tend to think is also a pretty good set of responses for that particular question. So I think what I'll do is I'll start with a little bit of description about what's going on here with the US, set in the context, just a little bit of what's going on globally, and then kind of dig into the responses to these questions, if that makes sense. So Maria, thank you for sort of hyping up what we've been doing with Common Pass, but really that's one small part of the puzzle and how the world is addressing the issue of people needing to move around during and in the aftermath of the pandemic with proof of vaccination as well as proof of negative PCR tests for COVID-19. And what we've seen, was sort of initially a proliferation of folks with lots of different solutions, some, very good and privacy preserving and based on the latest technologies, others, sort of based on legacy technologies that maybe are not going to be so great with privacy, but will probably work really well for existing airline infrastructures, for example. And then we've seen, email us a copy of your test result as a PDF or show up with it printed out on paper at a border. And all of these present interesting challenges, which I'll dig into a little bit, and then hopefully we can talk through in more detail a bit more interactively. What we've been focused on is a couple of things. So in the US, for those who don't know, we don't have any sort of centralized database or registry of our health information. We get care, and the people who provide us that care, they, as far as they're concerned, they own our data. They certainly control it. And we have to do what we can to get access to those data. We do have regulations in the US that provide us with digital access to those data using a particular standard called Smart on Fire. But the way that the data come out of those systems is not especially reliable in and of itself. So what we've decided to take on as an approach, and we in this case is the Commons Project, but also collaborators from the largest EMR platform vendors, from a couple of different tech companies who build vaccine administration platforms here in the US, and some health systems, the health tech community sort of broadly, was can we come together and agree to a pragmatic specification that hopefully will soon become a standard that we can all use to issue a trustworthy and portable, verifiable vaccine certificate or credential. The original, sort of notion here was to fully embrace verifiable credentials and the way that, the world is all moving in terms of self-sovereign ID and decentralized data. And we quickly realized that something a little bit more pragmatic was going to be needed for 1,000 different health systems in the US, let alone 50 states and 14 additional state registries to be able to produce this information. So we adopted something called the Smart Health Card format, which is a very pragmatic and sort of streamlined implementation of the verifiable credential specification. And essentially through this work, we got to a point where everyone agreed that, okay, we will issue these credentials to people. And what these are a bundle of information that are cryptographically signed so that you can trust that they were issued by who claimed they issued it and they've not been tampered with. And the package that's in that information is exactly the same as what's on our CDC vaccine cards. So your name, your date of birth, the date, and product information about each of the vaccinations that you received, and then finally who issued that piece of information to you. And so what this is signed clinical information. It's very different than a vaccine passport. It's not passing judgment on whether or not you're allowed to get into a country. It's not saying you're fully vaccinated or not. It's just a copy of your personal health record, in particular your vaccination record, that you can bring with you and people will trust it. Now that's what we've done here in the US, and we have several states. We have the largest pharmacy chains, we have the largest EMR producers or vendors all contributing to this. And within the next couple of months, about 120 million Americans will have access to these smart health cards. But that's just what we're doing in the US. In the EU, we have the EU COVID certificate. Each of the Asian countries has their own certificate. New Zealand is building something that's very much akin to the EU COVID certificate, but not quite. And then we have to figure out how to make it so that all of these various countries can accept and trust all of the certificates from all of the various other countries. And that's where this word harmonization starts to come into play. Standards are wonderful, but the odds of everyone in the world adopting a particular standard in a short period of time were slim. So how do we go about addressing this problem? And this is where we start to see different kinds of global infrastructure step up that try and allow people to move seamlessly from one place to the next. So with that, diving into the questions, I think seems like a good one. So, how easy is it going to be to game this system? So responses here were pretty all over the map, and I think that's pretty fair. In the US in particular, you could almost call this a trick question. When you show up to get your vaccine, you probably told them your name. Maybe somebody tried to confirm that it was actually you because they wanted to cash in on the insurance payment, the reimbursement that they could get from giving you your vaccine. But maybe not. And so this is the information that each of the health systems, that the state registries has about me. And so we could build on top of that the single most secure and biometrically guaranteed identity program management system, and make sure that my data are completely tamper-proof and I can bring those with me anywhere in the world. But if no one's confident that that record was actually mine when it was created, then really, where are we starting from? And so these sorts of questions about gaming the system become very interesting when the system itself starts from a place of being gamed already, potentially, if you want to look at it that way. But the way that we've derived and developed these systems, there are certainly some opportunity for gaming in traditional ways. The use of open standards in particular makes it so that anybody can produce one of these credentials, right? That's sort of the point, is that it's easy to adopt and it's transparent and everyone understands how they work and anyone can build them. So what we have to do is put in place things like trust frameworks so that we know who the issuers are of these credentials, so that even though they may be open and anyone could create them, you'll be seeing a valid credential, but you need to ensure that it comes from a trusted issuer, not JP's VaxMart that operates out of Tribeca here in New York. So on to the next question, and then I think we'll circle back and see what folks have to say about all of these at the end. Although I do see a question here, is the risk of gaming the system analogous to voter fraud? That is, might it be something that can happen, but after looking into it, very few cases are uncovered. So this is a really interesting one, and something I'm going to touch on a little bit with my thoughts on the last question about the autonomous systems. But there are open questions here about how much of this sort of risk countries and venues are willing to tolerate as well. The vaccines themselves are imperfect. If some small number of people are presenting credentials which are not valid, is that really going to make that much of a difference in the spread of disease? And a lot of it has come down, as far as I've seen, to the objectives of the various nations in letting tourists and other business travelers and other travelers into the countries. So if you compare an approach of a country like Rwanda, who's had a very good COVID track record, not sort of zero cases on the order of places like New Zealand, but a very good COVID track record, is highly reliant on tourism. Rwanda put in place a very aggressive testing and tourism program so that folks could get tested before they leave, get tested on arrival, and be free to travel the country within 24 hours if both of those test results came back negative. They also permitted you to just simply email or upload PDF copies of your tests. They weren't particularly concerned. The objective is to get tourists into the country, largely COVID-free tourists, but understanding that tests come with a large amount of likelihood that people are going to be positive yet test negative, they were accepting that. Contrast that with countries like Japan or New Zealand, or many of the countries, particularly in Asia, who have seen very few cases, or for quite some time have seen very few cases. The tolerance of risk for bringing new cases from outside has been much smaller. So on to the next one. Should we give away our personal information for the benefit of social good? So we've talked about this in various ways already. I think there's some interesting examples outside of the vaccine records that folks might want to noodle on this topic. One has been with the contact tracing applications. So sharing my mobility data as well as my COVID status information to a system that is sort of tracking my whereabouts and my contacts in real time could potentially be very good for curbing the spread of the pandemic. but is certainly something that many people consider to be, giving away quite a lot of data, right? That's not the topic for today, so we won't dwell on that one, but that's been the best example of this particular case in the pandemic that I've seen. But with the case of the vaccine passes and vaccine credentials, I think that in the first portion of this conversation, we covered a lot of this really well, right? There are cases where we have really good templates for this: border crossings, going to school, showing up for work with your employer, where the sharing of information is already happening and you're sharing just a slight additional bit of information. What are the additional privacy risks that people are concerned about with your vaccine record? With a few exceptions, like in the US, if you received your vaccine in January and you weren't a healthcare worker or a restaurant worker, that conveyed that you had a certain set of pre-existing comorbidities, right? That could be information that maybe people don't want to share. But aside from those few exceptions, there's not a whole lot there. So, what sort of risks are people really taking by sharing those data, and what are the benefits on the other side? Then, of course, we also have the set of situations which are a little bit fuzzier or squishier, the sort of day-to-day use cases. So, we have this Excelsior Pass in New York, which, not that many businesses, but certainly baseball stadiums and basketball stadiums have implemented. California has begun issuing smart health cards and has provided information that businesses who are interested in asking patrons for proof of vaccine are able to do so. Will we see people needing to show proof of vaccine to participate in indoor dining or use the public library without a mask? Things along those lines. And those are cases where things become a lot more interesting. Is contributing, is sharing my vaccine record at a restaurant actually for the public benefit or not? It's sort of quite an interesting question. And last, I want to touch on this question about the automated system letting us into country. So this is a little bit for fun, but is also a fairly serious topic. What is interesting to me about this is that we've seen fairly complex technical solutions being implemented around the world. And mostly those complex technical solutions are replacing what Deepak described, which is a person receiving a piece of paper or a booklet and making a judgment on it and letting someone go through. Those personal human judgments are certainly imperfect. Maybe they're more imperfect than an algorithm would be. Maybe they allow for more potential fraud, for more misinterpretation. But the human judgment also allows for just that, human judgment, which is something personal and contextual, and something that a lot of people are going to be much more comfortable with than the red X that flashes up on the screen and says that the algorithm has deemed you unworthy to enter this country. And we know this because we know that algorithms are flawed. We know that we don't have input into what those algorithms are. Algorithms can certainly contain biases, and whether they're biased against us or not, we don't really have any particular insight into that without the right kinds of transparency in place, which are very seldom in place for the types of algorithms that would be making these judgments. And last, what would the recourse be if it's wrong? Who do I take this argument up with? I would hope that most of these systems are having good in-person human fallback for reevaluating the evidence, but it's not entirely clear how exactly all of that will work.
So JP, you bring up so many fascinating points. And I think Alex probably shares a lot of the same common thing. But when we talk about, so with regards to the vaccination card, right? We're talking about the human versus the algorithmic and the digital. In the US, we already see that the vaccination card can be easily counterfeited, right? Like you look at that thing, I mean, an index card, I think could probably, a standard one you buy at a Staples or a local stationery store would probably look the same thing. So we already have this questionable sort of already, when you look at this thing, is this an authentic vaccination card, right? We're already starting to have these questions, which unfortunately, I don't know if anybody thought about, but this is the reality. And this is something Alex probably sees a lot in the pharmaceutical distribution chain about counterfeits and that kind of thing. But secondly, when these registries like the Excelsior Pass in New York State, how secure is this data, one? And two, what exactly, if it gets breached, what are they going to get access to, right, from that point of view?
Yeah, it's a really interesting question. So first of all 50 states, there's actually 64 jurisdictions here in the US, already have registries which store all of our immunization history, not just COVID-19, but all of our immunization history. The data that are in there are usually a combination of our first and last name. Some have contact information, a couple of known addresses, email addresses, phone numbers, those kinds of things. And then our date of birth and our immunization data. I would venture that these are not the most secure of systems in the world, but they're probably also not that exciting of systems for hackers to go diving into. But it's sort of hard to say. These systems that are then layered on top of them for providing vaccine passport services, they probably range in security and privacy protocols. But one thing that I think is relatively common is that because of the use of open standards and transparent presentation of data, systems like the IBM Excelsior Pass, like the Smart Health Card format, the QR codes themselves that people have on their devices encode all of the information in a way that can be decoded with open and available tools. Mm-hmm. You may not be able to do things like check the signature if you're not part of IBM's network, or if you haven't put in place the proper software. But if you can scan the QR code, typically you can get all of the information that's contained within, which is my name, my date of birth, the vaccinations that I received, and the dates that I received them. So really what we've arrived at is a place where there are less sort of technical security and privacy considerations and more personal and contextual privacy considerations. How do we educate the public that when they have this QR code on their phone, that it's the same as walking around with a copy of their CDC card, except that if someone scans it, they can enter it into their database. How do we make it known to people that when they hold up that QR code and it's scanned, that they need to actually, if they are concerned about that, inquire about the types of software that's been used to scan it. Are they using a privacy-preserving dedicated verifier application that does nothing but scan things and keep things on the phone? Or are they harvesting my birthday and adding me to a marketing database? I don't think that we're going to get to a place where people start asking that at the restaurant when they want to go for indoor dining. But these are the kinds of questions that people should probably be thinking about when using these sorts of digital certificates to gain access to services.
Very important point. Alex, how about you? I know you're doing a lot of work in this space, and obviously running into the distributed ledger technology question is, oh, we're using a DLT, then we're secure, we're safe, and everything is fine.
Yeah, I mean, so there's a sort of difference between distributed and decentralized, which we're running into fairly regularly. Which is if everybody is sharing the same distributed ledger, but all of the private keys are being held by a few key players, it's not really all that secure. What we saw with SolarWinds was that when you have these repositories where identities are held or data is held, and you can just sort of go in and scoop them all up at the same time. Our work is focused again on pharmaceutical supply chain rather than COVID vaccination passports, but we're seeing some fairly significant overlaps. For a little bit of context, in the United States, there's this law called the Drug Supply Chain Security Act. It's passed in 2013. It's got a 10-year roadmap. There are a number of different requirements in there, but one of the big ones is that authorized trading partners, manufacturers, wholesalers, third-party logistics providers, dispensers, pharmacists, are only able to exchange data with each other or trade with each other. And for the most part, this is handled through kind of existing policies and procedures, right? If you're selling to somebody, or if you're buying from somebody, you already have policies in place to be able to build a business relationship with them that goes fairly above and beyond what the requirements would be to just figure out whether somebody is allowed to prescribe drugs or manufacture drugs in the United States. The problem that the industry has been facing, however, is that there are a few scenarios where parties that have no prior business relationship and have never dealt with each other before have to be able to exchange data securely. How do you know who you can exchange data with? How do you know that they're entitled to have access to that data? That's where this sort of decentralized identity question comes in. And, you know, to some extent, it's the challenge of a network effect. We're looking at something like a couple 100,000 authorized trading partners within the United States. We're talking about, you know, making claims. You know, I'm a dispenser. I have the right to this information from a given manufacturer. I can ask whether or not this drug is real or not. That's not something a consumer can do. That's not something that somebody who is not in possession of the drug can do. Much in the same way on the COVID vaccination passport side, or, you know, really any of these areas, it's a matter of, you know, where is the data located? Is it held in centralized repositories or is it held in private storage? Who has the right to access that data? And how do they demonstrate their right to access that data? Is it that, you know, the data is simply there and it can be provided through any, you know, through any sort of number of spoofing vectors, or you know, is this a situation where somebody's, you know, private key pair is being held locally, or they're able to sort of demonstrate their identity in ways that are over and above, you know, a small card.
Right. For sure. Okay, so Alex, I didn't get to also do your official and proper introduction. So everyone, this is Mr. Alex Colgan, and he's with Ledger Domain. And Ledger Domain, I've had the exciting opportunity to be, I was at the origin of one of their pilot projects called KitChain, which is obviously the supply chain, clinical supply chain tracking using distributed technologies. And also Ledger Domain was really, really fascinating in this other pilot that they did called Brew and Chain, which was on the pharmaceutical drug supply chain distribution side of it. And Alex brings we're going to put some questions up from some polling questions with regards to Alex's work and that kind of thing. But one of the interesting things about Alex is that a lot of the work is something that we touched on from Deepak and JP, which is going around authority figures in a way is like, who has the right to access what, when, how, and how are we tracking that, which gets to the core of transparency. And this is a lot of the work that Alex was starting to hint on around the decentralized identifiers, you know, setting up this process where you have authorities can do X versus who can't and who can. And I think that's some of the exciting interlay here with when we look at these vaccine passports is how do we set up this from a technical perspective, like who can touch what and when and why. And I think, and how is that going to really work? And what does that mean for, obviously, for the average citizen who is going through these different, you know, either ports of entry or like JP said, if you're using the pass to go to a local restaurant or some activity and that kind of thing. So for you audience out there, we put up a couple polling questions again, and please take a look. One of them is, what is the biggest obstacle to personal data sovereignty? Yeah, that's a huge issue. We run into it not only in healthcare, but across your entire, let's call it your digital citizenship. We run into that quite a bit, that question. And the second question is should states be empowered to share the vaccination status of their citizens with other states? So, you know, again, I think this touches a little bit about putting your data for public good, right? If you know that your state, we're seeing a lot this now in the US, certain states are way behind in their vaccination record. Other states are super excelling at it and they've got, you know, really high percentage counts. We already sort of see some level of sharing of data going on. At what level of identifiable information is another question, but we're seeing aggregation of numbers already being shared publicly on what's going on. So I think this is a really good, important question because it's very, very current. Okay, we'll leave a few more seconds. There we go. And take it away, Alex.
Yeah, so this is interesting. And nobody picked other on the first question, which is quite, I wasn't sure if I had managed to sort of capture all of the different obstacles that people might see, but public lack of awareness certainly does seem to be a challenge. I talk a lot about, you can hold your own public-private key pairs, but most people are, just want to pursue the fastest path to, getting into their favorite vacation destination, or, getting in and out of the door to the doctor's office, and maybe aren't so concerned about what happens afterwards until it surprises them. And interesting about the sort of state-based empowerment. So, as Maria alluded to, again, a lot of our work has been in pharmaceutical supply, but there have been a fair number of really interesting overlaps. And some of the incentive structures that we've seen are the same. So in the way that the FDA, for instance, has been pursuing enforcement of DSESA, we go back to this question of, what are the incentives of the different stakeholders involved? What do the people involved actually want? The different pharmaceutical companies, of course, everybody wants to mitigate their own risk. Everybody wants to manage their own house. Obviously, everybody wants to make money within the context of a well-run healthcare industry. FDA is obviously very interested in making sure that counterfeits don't make it to consumers. They're interested in making sure that good drugs get approved relatively quickly and that bad drugs are kept out of the supply chain. FDA is also very concerned about overstepping their bounds. There are a number of different considerations at play. A lot of active pharmaceutical manufacturing is being done outside the United States. Again, we come back to this national security question. So FDA is interested in doing all these good things, but also wanting to be very careful about making it difficult for pharmaceutical companies to do business within the United States, because they don't want everybody jumping overseas. So the incentive there is risk mitigation. We want a well-run supply chain. We want data standards. We want electronic interoperable system. But we don't want to be the ones that run it, and we really want to take sort of a hands-off approach in terms of imposing how it's going to work in particular ways. So that's FDA. The big pharmas, the distributors, even the dispensers, everybody is now fairly heavily incentivized to pursue a standards-driven approach, because under the law, they're going to be required to. At the same time, they get to define a lot of what that means. Is this a big centralized database of all of the drugs that exist within the United States? None of the major farmers want to go that way. None of the distributors want to go that way, because everybody wants to be able to manage their own data and manage their own access to data. So you have a little bit of a tension. How do you have an electronic interoperable system that's able to treat each package of prescription drugs sold in the United States as a unique asset if everybody's maintaining their own systems? So this has been a case where distributed ledger or decentralized ledger has been we're moving very, very fast on that as a result. Tied into that is this question of identity. Who's able to get in? Who is able to access certain types of information? If I'm a manufacturer, I should be able to add serial numbers of drug packages at the top of the supply chain. If I'm a dispenser, I should be able to pick up a package and scan it and ask the manufacturer if it's real or not, and be able to get a response relatively quickly. In order to be able to achieve that, you have to have an identity layer. And there are a few different ways that you can approach identity. The way that we've been approaching it has been strictly decentralized. Public-private key pairs being held on local devices, independent review of, in this case, pharmacist credentials. Are you a pharmacist? Are you the pharmacist that you claim to be? Is your license active? So in the case of these decentralized identifiers, what you have is a unique ID, but then a number of claims that are sort of nested around it. I claim that I am who I say I am. I claim that I am this pharmacist. I claim that I am licensed to practice pharmacy in the state of Texas. All of these claims are associated with particular privileges. The bigger the claim, the more privilege you ask for, very likely the more proof you're going to require. And where it gets a little sticky and where we've been doing a lot of our work and leaning into W3C verifiable credentials and some other common standards is, how these claims are being managed, how they can be associated back, how they can be checked, and what levels of proof are required at each stage. Applying this over to vaccination status, you could see a case where I am myself. I am associated through having established a link to a set of private data that exists elsewhere, that is encrypted, and that I have keyed access to. Maybe my healthcare provider has keyed in access to it as well, and they can see all of it, all of my healthcare data. If I want to move over to another healthcare provider, that other healthcare provider gets keyed in access to it, and the previous healthcare provider has that key rescinded. So what does this mean? It means that the data exists in a place where no individual healthcare provider, no individual government, no individual party is necessarily holding on to it, but rather they're accessing it and accessing parts of it that they're keyed into, specifically because they have been given the right to get into it. And again, my public-private key pair might be something that I hold, or it might be something that I give away. If anybody here is familiar with Bitcoin, you can hold and manage your own Bitcoin wallet, or you can give your public-private key pair to Coinbase and they can manage it for you. The difference is that you can take it back from Coinbase and you can give it to somebody else. Under how a lot of these systems work nowadays, you don't really have that right. The data is being held for you, but make no mistake, the data is not yours. Oh, you're muted, Maria.
Yeah, sorry. So we're really talking about accessibility in this case, right? So I think we had another workshop a few weeks ago at RightsCon. We were talking about data ownership, right? I feel like it's this philosophical, like Captain Obvious in the room. Like when we talk about data ownership, what are we really talking about? So in this case, here we are again talking about data accessibility. When it comes to, it's really important we talk about this vaccine card, because JP also mentioned it. When it comes to our vaccinations beyond just COVID, they're building this database, and more in the US, I think we might be seeing this. You get this questionnaire, like, would you like to be a part of telling us which vaccines you received, like for hepatitis A or other types of sort of therapeutic areas, and they're building this database. I mean, that's pretty much why they're asking you if it's okay to share this information. But I think that, that brings up a larger question about this COVID, specifically COVID-19 is not to say that the whole population can't get hepatitis A, but it's just so omnipresent. Every single person can get COVID. And we're seeing now this, race to normalcy. And the question is if I don't give my data, like we have people who don't want to even take the vaccine still, right? We still have this challenge, right? That's whatever, 40% of, I think, US population, a little more. And now we have another emerging problem, like, well, I don't want to give out that data. I don't want to tell the airport that I did this or not. And how is this going to get back to my employer, which we didn't even start, we're starting to see the percolation of this challenge coming up from employers and schools, and I don't want it, and this kind of thing. So the question first becomes is, all I have of my vaccine record is this card given to me from the CDC, which anybody could actually counterfeit and reproduce. So I technically don't even have access as of right now, unless I do Excelsior Pass, which taps into a public registry and I can get it XY. I don't own this data. Is it better to say I own the data and I decide how to share it and doesn't sit in a public centralized database? Like, would that, how feasible is that? Like, because then the question becomes, where are you going to access this record from, right? Where are you going to pull the fact that you actually had a real CDC issued, approved vaccine. But is that even a possibility using technologies that we have today?
Yeah, I think JP could definitely speak to that. That's in his wheelhouse.
I mean, I'm going to say that the answer is yes. We certainly have the technology to make that happen. If we could make that happen in this country, fit around the various bits of infrastructure that exist and how those data would get generated, is a different sort of question, right? But we know that we have the technology to create a digital record of something and to create an audit trail for that digital record and make sure that it doesn't go away, right? And I could control that record. I could decide precisely who I want to share it with, under which conditions. Sort of clawing your data back is a very different story once you decide to share it. But at least I could decide where to share those data. But for public health reporting purposes, we are required by law to report all of our immunizations up to our states at least, and states are required to provide anonymized versions of those records to the federal government. So we're not going to end up in a completely decentralized system for immunizations in this country anyway, even though we may be able to accomplish that. There's a broader question about sort of where the root of trust in clinical data lie and how we move that around the ecosystem. Currently, all of these records exist in moderately interoperable silos at the various places where we've received care. But there are a lot of folks, us included, who are working on giving people access to all of their information and letting that be the record of trust, right? Whether that's your immunization record or the list of procedures that you've had. When you show up at a new clinical practice, why is it that I don't have control over those data and sort of make an act of sharing those information with my new provider, as opposed to that new provider sort of tapping away a few buttons and going and fetching whatever records they can find from the various pre-existing silos. So that's something that I think we're moving towards. But the idea that we would be able to have fully decentralized health records, let alone vaccine records, while technically possible, I think is definitely a little bit challenging from a from practice standpoint. Mm-hmm.
So Deepak, in Europe, how are we addressing sort of this issue, right? I sometimes answer, I'm going to say, and I hear it through, let's call it word of mouth, that it's easier for a foreigner to come visit some European countries than for like a citizen within a European country to travel within their own country. Like I've heard, I don't know if this is true, I'm just throwing this, but I've heard some of these stories where things like this are happening because they're not really sure how to handle these. How do you show proof of vaccination or, that kind of thing, especially during lockdown status. So perhaps maybe you can share some insight what's going on in Europe from this point of view and how they're approaching these kinds of things.
Okay, so I think that the problem that you've highlighted, which is an inconsistency in the rules, is a problem that we've seen, unfortunately, because there has been a mixture of scientifically driven, epidemiologically driven thinking and politically driven thinking coming together in each country at different moments to create a casserole or a stew that results in decision making that sometimes defies logic. And I think it's happened because COVID-19 is not only a medical or a public health concern, it's a political concern. So there's been more complex multi-stakeholder interactions than there would be for most other things. And I think it has resulted in inconsistencies. So we just have to live with that. I don't think we have the power to change what politicians do easily. Ballots only occur every few years. So we have to live with that, but I don't think we should generalize from that. I don't think we should try to infer good patterns and practices from that. What I would like to say, though, in response to some of the interactions of the last couple of minutes, is that one of the strong messages about our European data protection rules are that the purpose of use has to be upfront and made available and acts as the boundary on what you can do with the data. The issue is not who you disclose it to, it's the purpose. And so if, for example, data is used by if I had an ideal environment, let's not pretend that I can control what border control agencies do, but what I would expect is a border control agency would say, as part of its public transparency notice, not of course they would ever produce one, but if you imagine they could, they would be stating that we take your immunization data in order to verify that you are permitted to enter a country, and we retain that data as evidence that we have made sound decision making, and we do not use it for any other purpose. That would be nice. Then it means the schools are not going to get that data, restaurants are not going to get that data, and so on. And I think that's what we should be pushing for more: purpose-specific disclosures and a combination of accountability and transparency by the organizations with whom we disclose it, that they have respected that purpose and not started to reuse the data beyond the purpose that they declared and that we trusted when we revealed the data. I think that is what we can do. I think we can do it in a socio-technical way until the technology is distributed, and then we can actually have methods of holding bodies accountable for what they've done because we have the technical knowledge. But until then, at least let's get that transparent declaration.
Thank you. And so we got a few minutes left. I first of all want to thank you panelists for really insightful conversation from a technical, policy, humanistic aspect of this whole, I'm going to call it this complex web that we're calling this vaccine passport. When I originally started bringing this session idea together, these are all the key points that were embroiled in this concept. To many of us, we just think, oh, I got the COVID vaccine, get my passport, and I can travel, and it's as seamless, and here we are, this is all going to work. Technically, it works, right? You show your vaccine passport, you get in. But there's so many underlying issues that we all, as consumers, individuals, patients, need to be aware of. And privacy, the security, how it's used. Deepak brings a good point. Is it the purpose? Is it who owns it? Who touches it? Who has the right to touch it? These are all really critical questions. And again, today we're talking about COVID-19 because it's impacting all of us in every aspect of our social, professional, healthcare lives. But there will be another unfortunate communicable disease, maybe not a pandemic, could be an epidemic, which is not friendlier, but it's just there's always going to be the next one. And the question is could we get it right now? Can we fix it in such a way today so that it'll be seamless the next time? And then maybe we could actually address more issues around the medicine rather than the policy and the social behaviors and that kind of thing. So this is what we wanted to come across to all of you, that it is not only a policy challenge, not only a technical challenge, it's not only an industry challenge, it's an everything challenge. And just a simple act of saying, here's my passport, I had my vaccine, I want to come into your country, and is it okay for me to be here? And I wish it was as simple as that, but as you all can see, that we've just started to scratch the surface of how many challenges are underlying there. So I want to thank all of you, the audience, for being with us for an hour and a half on this exciting Thursday. I hope that we maybe answered some of your concerns, or maybe inspired you to think about other things. I invite you to come check out the IEEE Standards Association Healthcare and Life Science site. We are a global group attacking many different areas of challenges in the healthcare life sciences domain, from technology standards to ideas for standards, to how we can help policymakers understand the technologies and issues surrounding some of these complex areas, from decentralized clinical research to the vaccine to patient data agency for precision medicine. We're covering many different areas of exciting, hoping to move towards the future of healthcare. So with that, thank you all, Deepak, JP, and Alex, for being here with me today, and all of you, and hopefully continue to stay safe and well, everybody, and hope you join us on our next series of virtual programs and educational sessions. Bye-bye.
Thanks, Maria.
Thank you. Thank you, Maria.
Bye, everybody.
Bye. Bye, everyone.